Nasogastric tubes are not flushed, nor any liquid/feed is introduced through the tube following initial placement until the tube tip is confirmed by pH testing or X-ray to be in the stomach. In line with NPSA 2011/PSA 002, checking the pH of gastric aspirate should be the first line testing method to confirming the position of an NG tube. It's important to check the position of the NG tube on insertion. However, despite correct confirmation of the position initially, it's still possible for the tube to migrate or dislodge away from the stomach into the esophagus or into the lungs, where feeding could prove fatal. Therefore, the British Association of Parenteral and Enteral Nutrition recommend checks are made. Following the insertion of the NG tube, before administering each feed/water flush, before administering medicine, following episodes of vomiting or excessive coughing, following evidence of tube dislodgement, in the presence of any new or unexplained respiratory symptoms or reduction in oxygen saturation, at least once per day. The Enteral pH paper tub contains strips with 3 coloured pads, one red, one green and one yellow pad. The colour of the pads will change when fluid has been applied to all 3 pads, as demonstrated in this training video shortly. The Enteral pH 2 to 9 paper is CE marked for the determination of the pH of human gastric aspirate. Before using the Enteral pH paper, check the expiry date on the tube. You'll find the expiry date next to the CE mark on the tub. The expiry date for the Enteral pH strips remains the same after the tub has been opened, if the tub is resealed after each use and the strips are kept in its original airtight container. Attach an oral/purple enteral syringe to the NG tube and gently pull back the plunger of the syringe to withdraw gastric content from the stomach. Remove the syringe when enough stomach content to cover 3 pads has been withdrawn and attach the cap of the NG tube to stop stomach content from leaking. Remove 1 strip of pH paper from the tub and reseal the container before covering each coloured pad fully with fluid. Line up the strip with the colours on the Enteral pH tub to verify the correct pH number. All 3 colours must match up. The pH on this patient is measured at 2, which shows the aspirate to be acidic. According to the NPSA, a pH value from 1 to 5.5 is safe to feed. However, some local policies might vary from these guidelines. Therefore, local policies should be checked. In the example shown, the pH is 7, which suggests that the tube may not be placed into the stomach and feeding must not be commenced. Can't get gastric aspirate. On occasion, it may be difficult to obtain gastric aspirate on the first try. The following suggestions may help you. There may not be enough gastric secretion in the stomach, which may be because the patient is nil by mouth. Ask or assist the patient to brush their teeth if possible, or perform mouth care to stimulate gastric secretion. Wait a few minutes and attempt to obtain gastric aspirate again. Tube may be above fluid level. Reposition the patient, e.g. turn patient onto their side. This may allow the tip of the nasogastric tube to enter the gastric fluid pool. Retry to gain aspirate. Tube may be in the small bowel. If the tube is placed into the small bowel, the pH will normally be 6 to 8 and bile will usually be present. Withdraw tube in small increments, testing the pH at each increment. 10 to 20 centimetres in adults, 1 to 2 centimetres in children. Tube may be in the esophagus. Advancing the tube can help reach gastric fluid present in the stomach. Advance in small increments, testing the pH at each increment. 10 to 20 centimetres in adults, 1 to 2 centimetres in children. Tube might be occluded in the mucosa or kinked. Using an oral/enteral syringe, insufflate 10 to 20 millilitres of air in adults, 1 to 5 millilitres of air in children. This can help to move the tip of the tube and allow aspiration. It might be useful to wait up to 15 to 30 minutes and try aspirating the tube again. If the patient has a safe swallow, elevated pH values might be addressed by asking the patient to have an acidic drink, for example, orange juice. Aspiration can then be repeated. If possible, incorporate a break in feeding of at least 60 to 90 minutes, which may allow gastric pH values to decrease sufficiently. If pH is high due to medication, adjust timing to ensure the longest period of time possible has lapsed between administration of medication and pH testing. For example, do check first thing in the morning before giving medication. If pH remains outside the levels appropriate for feeding or aspirate cannot be obtained, the patient should be referred for an X-ray to confirm correct position.